we are going to be looking at foundations in searching the biomedical literature. This is our second session in this. The first session we looked at and we took a tour of the CIRHT Information Resource Guide. We will be referring to that for a few moments as well during this lecture. So one thing I want to let you know, I know everyone is calling me Preet, which is my name, but my full name is Gurpreet Kaur Rana, and that's why you see that on the slides. You may wonder who that might be. No, it's really okay. My friends, and I count all of you amongst my friends and family, call me Preet, which is the last part of my full name. So I am the Global Health Informationist at the PubMed Health Sciences Library. And so one thing that we're going to be doing today is thinking about what we're going to cover. The reason why this is referred to as an overview is that anything that we present here or anything we discuss, one needs to really get into and implement and practice the skills or the principles that are presented. So it's an overview. We could talk about searching the biomedical literature for 8 hours. We could do an all-day or even an all-week workshop on it. So this is just a very small overview of what we're looking at. One of the most significant parts of searching the literature and the scholarly literature is developing the research question. Sometimes we don't focus so much on that because we are so enthusiastic to get into right away to searching. But the search process, which is the second part of what we're looking at, actually searching, the action of searching on our computers is far from the first thing we're going to be doing. So we need to start thinking about planning and implementing. The third thing, if we do have time, is we're going to do a brief introduction to the new PubMed interface. I want to say that the new PubMed is new to me as well. It was the new look for PubMed, which I believe all of you have had some level of experience working with. PubMed, otherwise known as Medline, introduced a new look and a new way of presenting the database about a week and a half ago, maybe even less than that. So we knew that a new look was coming, we just did not know when. And I'm just very glad I was not teaching a class when the interface transition happened. That's what I was doing when the last PubMed interface transition happened. I was teaching a class and everything changed while I was teaching. And let's say we're all in this together. So we are here in this process. But what happens is there is so much for us to look at within the literature. Where do we start? Where do we go? Some of these are PubMed, there's Google Scholar, there's Biomed Central, there's news sources. You know, these are images of so much of what we do go over. And how do we figure out where we start and how we develop our search strategy? Before we even do that, and some of you may have seen this when we did a training in Ethiopia, this is an image called Information Chaos, and it's from an article about searching for information in the clinical setting, but it also applies in the research setting, searching for the scholarly literature. We often think of our situations as being an information overload, when in truth, we don't have an information overload, we just have that is only one portion of it. When there's so much, or thinking about so many different sources we want to go to. Another portion is underload, when the information we need is lacking. We have all been in this situation as well. Another portion of information chaos is when information is scattered. And this is something that as scholars of the biomedical literature, you're going to find quite often. Being able to identify and be knowledgeable about the sources or the databases, the sources of information. So one is more, has a better handle and a better hold of where exactly you are going to search. What is your protocol for searching? So whenever I start searching, I develop a protocol, and that may change, but at least I have an outline, and that's what we want to talk about. The next piece amongst information chaos is conflict. So that's when we're unable to determine amongst data sources. In addition to searching the scholarly literature, we're also searching scholarly data. And not all data sources are giving us the same information. And that's when we need to consider our sources, the currency of the information, and exactly how it was collected. So next we have erroneous information. I know that I have come across erroneous information, and I imagine everyone at this table has at some point or another. So we need to be very careful and cautious of the sources that we use and that they're trustworthy to us. So I'm going rather quickly, but this slide here is one, if you recall nothing else, this is the one that I want you to remember. If you ask a searchable question, you have a better chance of being able to develop a search strategy. And once you do that, you are better able to match an information resource, information database to your information need. So what does this mean? When we are looking at doing a project, we have so many ideas. And what we need to do is we need to titrate them down into what is our bottom line, what is the actual question we are asking. In some situations, we may be asking more than one question. And my answer is to do more than one search. Often what we find ourselves doing is we try to combine all of our searches, we combine all of the questions we might have into one search. And that's not a strategic way of thinking of things. So here we have our titration, and for those of us who remember doing titration at some time or another, you'll notice that there's a lot, and we titrate it down into what it is that is important for us to be searching or investigating at that time. Many of you have submitted research proposals, and you all have to titrate down to what is the bottom line question I want to ask. Strategically searching for relevant information and within the database also means for us to understand levels of evidence. So when we're looking at background information, we're looking at textbooks, expert opinion, and this may be when you consult with your peers or faculty. We're looking at reviews of the literature. So those are our foundations. When we then start looking into the levels of evidence, our pyramid, then we start thinking about primary studies. And when we are doing research projects such as you are doing right now, you often are focusing in on the primary literature. And that can be anything from case reports to randomized control trials to systematic reviews, but actually systematic review and meta-analyses are secondary literature because they're evaluation of primary studies. So that's the next level. Then we have synopses, and very often those are guidelines, summaries, and systems then moves on to an area of looking at using content in practice and clinical care. So we're not going to focus so much on that one. Now, when we think also about the steps of finding evidence in the clinical setting, and remember, today we're talking about the research setting, but this is an example of the 5 A's, and we have gone over this before, but the 5 A's are ask. It's so important to formulate that clinical question, right? Access, developing the strategy to track down the best scholarly evidence. Appraising, being able to identify the evidence for its validity and usefulness. And as clinicians or as researchers, you have the skills to work with your colleagues to identify and appraise that. And many of you have done that in the past or are doing it now. Applying it. And so again, we're still looking at the clinical piece here. We haven't gone into research. I wanted you to show you a clinical research cycle here. So you're looking at application of integrating the results into patient care settings into the local conditions. Local conditions, for instance, here means Ann Arbor, Michigan, but for you may mean Kigali, or it may mean Addis, or it may mean another location. So thinking about all of the issues that work around when you're doing work in a clinical setting, when you're treating patients. And the last thing to do is to assess the effectiveness or the outcome on the patient. Now, if we were to take the same idea and then think about navigating scholarly literature and looking at the research cycle, now we're looking at the exact same table, but let's look at it from the eyes of a researcher. So when you are searching the biomedical literature for a research setting, searching literature in a clinical setting and searching for literature in a research setting, those are two very separate points of view. In the clinical setting, you may want to get clinical guidelines, or you just may want to have a smaller but more synthesized level of evidence. In the research setting, you may be doing a much more comprehensive and lengthy process of searching the literature. So again, formulating the research question, A for ask, access. Now this is different. This is when you want to develop your strategy to track down the best evidence. Appraise, you're still looking at looking at how you would appraise evidence for its validity and usefulness. Apply, that's when you integrate the results into your research project or research proposal. And lastly, you're still assessing the effectiveness in the process, but as opposed to the assessment being on patient for instance, either on patient prognosis or treatment or outcomes, you're looking at evaluating the effectiveness in identifying the literature and the assessment of that literature. This can be these 5 A's that I've referred to. This is just a very easy way of remembering them. Ask, access, appraise, apply, assess. The 5 A's. It can be presented in other ways. This is a research cycle. And if you do look up research cycle or do any type of research on it, you'll see different views, but really talking about the same thing. This is a research cycle where, again, so important, the first thing to do is develop the searchable research question, selecting methodology, designing data collection methods, collecting and testing and analyzing your data. Use your findings to address the research question. And lastly, to submit documentation for publication and examination. But that's not the last step. That step of documenting and understanding your research then should lead you into a new question. It's it's a circle, because our research leads us into more research and more questions, because as human beings and as OB-GYN or whatever area is your expertise, you are constantly searching and constantly wondering. That's the human condition, is it not? Is it not, Daniel?
Yes, it is.
Yes,
Absolutely.
it is. Yes, it is. So the yellow part there, and the orange part, the red, orange, and yellow, those are the parts where we're talking about searching of the scholarly literature. The green, analyzing, the blue, the addressing of the questions, and the purple, submitting and documentation, those are steps that come throughout the process. One thing I want to absolutely emphasize with you is you do not stop searching the scholarly literature at any point in your research cycle. You're constantly looking and developing and saying, okay, what else is new? What else is new out there? Because you don't just stop searching for literature, even if you're at the point of writing the documentation or collecting, analyzing data. Another way of presenting the research life cycle is that the research cycle is a little more messy. It's not a circle, it's many circles. This is one that was developed in the library at the University of Central Florida. It's a much more warmer climate than here, so maybe that's why they think better and they develop this. Our brains get frozen in the winter. Do they not?
I wouldn't be able to answer. It's frozen.
So here we're thinking about within each of the cycles, there are cycles of themselves. So the planning, the research planning cycle, you're looking for grants, you're developing the proposal. You then go into the research concept, and then you have the management, the publication cycle, and then looking at conclusion, dissemination, sharing with the global scholarly community, but then going back into, do you know where we have right here, this idea section? That's where we have to identify the clinical question, where that light bulb is. So I'm going to move forward. And again, you'll notice that we're not talking about getting right in and searching. These are things we have to think about before we actually actively search the literature. I just wanted to make sure that you are aware of the CIRHT Information Resource Guide. You can see it on the CIRHT site. And the link is also here. This is a place where you can go for high quality information. I also want to emphasize that you can go to your library. You have wonderful libraries on your site, and I see one of our librarians on our call, and I know that she would be a wonderful person for you to connect with, and she's smiling, I can see this. So this is one place for you to go, but not the only place for you to go to access information sources. Just giving you a look at what the CIRHT Information Resource Guide looks like, you see that it includes, there's a navigation bar on the left side showing you research and clinical resources, open access, books, organizations, data sources. And I'm not going to emphasize this, I just wanted to make sure that you are aware of it. So let's get into some of the foundations of searching the scholarly literature. And again, I'm repeating this slide again because this is an important one for us to remember. What is your question? If you focus your research question, it's more, you have more success in identifying your information resources and developing your strategies. At present, I am working on a search with a faculty member on sickle cell disease and the transition from pediatric to adult patient care, and the transition that takes place. But I have not actually started searching. I am at point 1, 2, and 3. So I'm just starting to organize my search strategy. But I've been working on this for about a week or so. Maybe actually more. I've been working on this for about a month or so, but first we established the research question. Then we had a protocol. Then we identified sources we wanted to search. Thirdly, I have been going into the subject searching, looking at other articles, and developing keyword concepts. Fourthly, I am now starting to organize a search strategy in PubMed, which I will then translate into other databases that I want to search. My step that's coming up soon, but remember, I've been working on this for about a month. My next step is running the search. The actual typing did not start until a month into the project. The idea is for us to really think, and yes, I did some searching to find search terms, to identify the type of literature I wanted, but the actual search for the project has not been run yet. So then I want to evaluate my search results, and this is where I may revise my search strategy. So for instance, if I get 100 articles and only one of 100 articles is useful to me, I need to rethink my search. Now, it really depends, you know, this is all, searching is like math, but it's also like diagnosis. So we do have sensitivity and specificity of the search results. What was my sensitivity of that search? What was the specificity? The seventh is we're looking at selecting and organizing articles. So let's go through some of these steps in a more individual basis. So step one, we were talking about identifying the research question. This is where we have a clearly defined and focused question. You develop your strategy, and that allows you to then consider, oh, I'm going to search PubMed, but this has some OB-GYN nursing aspects to it. Maybe I'll search CIRHT, which is a nursing database you can access through Hinari. I'm thinking that there is some information here that may tend well towards looking at some, I may need to look at some of the WHO reports on contraception. So I know by the question where I need to go to find the information. Let's take, and we'll take a look at an example of that in a moment. Before I move on, I wanted to show you the diversity of searching that is available. I don't expect you to memorize this. I don't expect you to do all of this type of searching for every single project you have. Every project is individual. So you think about the needs that you may have for each project. The first one is database searching. That's when you may search PubMed, when you may search databases such as CIRHT, or you may look at Embase or Scopus. Reference tracking, and some of you may have done this, is when you are looking for articles from the bibliography of an existing paper. Many of you have had a really good paper and you have flipped to the back and looked at the bibliography. That is called ancestry searching, because you are searching for the ancestors of that paper. Also called snowballing, because the more articles you look at, the more you get. You can do reference tracking using Google Scholar as well. And we looked at a bit of that at our last webinar, where it says how many articles cite that paper. And that leads us to citation tracking. So that allows us to see who has cited that paper since last time it was published. And so Google Scholar is one that allows us to do that. Scopus is another. Not always, but sometimes we may want to do a registry search. These may be ongoing clinical trials. And I have just given you some examples here. You will see more clinical trials registries in the CIRHT resource guide. Or you can also look at the World Health Organization has a larger registry search guideline as well. The one that is well known is clinicaltrials.gov, Cochrane Register. Hand searching. Now, hand searching is something that you would want to do more of if you were doing a systematic review. And the same with expert contacts. If you're doing a comprehensive research project, you may want to consider if this is the right thing for you. Conference proceedings, that's another type of searching. Now, internet searching, this is the buyer beware search. This is searching just Google. This is searching a search engine. And any information you find, you have to evaluate, or any data you find. You are the evaluator. You are saying, what is the source of this information? When was it created? What is the currency of it? And exactly how relevant is it? So you are looking at the where, the when, the how of this information. Because often when we search just the internet using Google or Yahoo or any search engine, you are responsible for that information. Finding international literature. Sometimes some databases focus more on that than others. For instance, PubMed does focus on international literature. If you're using Hinari, you are also looking at more of an international perspective. And the last one is one that we often overlook, and that is finding gray literature. What does that mean? It is sometimes called fugitive literature because, you want to know why?
I would love to know why.
Can you guess?
They haven't been published. They're
No, they've been published. They're hard to find.
Oh, I see. Okay.
Yes, they've escaped jail. Fugitives are not easy to find. What is fugitive literature or gray literature? This refers to reports So for instance, in PubMed or a similar scholarly database, you're not going to have a report from the Ministry of Health in Ethiopia. You're not going to have the Demographic Health Survey. You're not going to have a World Health Organization report. So you have to be able to consider the reports, book chapters. It could be data sets. And some of this, the CIRHT resource guide can help you with some of this. But thinking about that type of information, you're not going to find reports from an institution, from the government. These may be sources you need to find on your own. White papers is another one. Dissertations can be another form of gray literature. Then another characteristics of scholarly literature are different patterns. There's the older versus the newer. Depending on your topic, you may want to go into the older literature. Now, we were looking at this yesterday, I think, were we? Like HIV goes into the 80s, you know.
Right.
But if you were looking at, what is it?
Pregnancy, I know, is another
which
one.
one?
Pregnancy.
Pregnancy will go really far back because, shockingly, women have been having children for a very long time. But there's some diseases that are, or issues that may be newer than others. So, for instance, information about antiretroviral drugs may be like the mid 80s onward.
Like 87, I think.
That's correct. So looking at that and also not forgetting the older literature. For instance, if you are looking at aspects of contraception, you may be looking at a more of a historical view of it, and you do not want to disregard any of the information that's older, depending on your research question. Refereed or non-refereed. So this is the scholarly versus an article you might find in a magazine. Again, it depends on what your needs are. Something we have to remember is delays in publication. Now, with an electronic environment, we have less delay in publication, but just remember that as you are going through your process of searching, that an article that you may have found in your initial search you may not have found in your initial search by the time you are ready to synthesize and investigate your literature may be published. So the idea of constantly running your search strategy is not inappropriate. Also, and this is more for the individuals in the United States, is we do not as often take advantage of the non-Western literature, and we should. So, for instance, the Africa Index Medicus, the literature that is published, and it is so valuable from the continent of Africa for us, is something we need to look at. Or even if you are, for instance, Asian literature, and being sure that you are looking at literature. The one challenge with that is if it's in a different language that we do not understand. But very often in PubMed, the abstract, at the very least, will be in English. So another thing is to think about characteristics of scholarly literature is communication with authors. If you constantly see, as you're doing a search, you constantly see one author coming up, there is no harm in reaching out to that author, especially if their email address is in the paper. And we hope you get a response. We hope that there's a collaborative feeling. And I've done that myself, where I've seen an instrument that has been used in a paper, and I want to know more about it, and I had reached out to authors. So we're going to start now by looking at the question. And this is a very simplistic case of, it's a clinical case, but it could also be a research question. It's a very simple view of it. And the idea of, we're going to start by the idea of titration into our research question. So my scenario, or something I'm looking at, this may be you and something that you found in one of your situations and you want to research it more. There's been a special clinical conference to discuss the use of macrodantin versus Bactrim in treating young teenage girls with urinary tract infection. One hospital recommends Bactrim, and the other hospital recommends macrodantin. You must come up with an evidence-based recommendation for what the hospital should use. At least you want to. So that's your project. What does PICO mean? Well, PICO is just a way for us to consider the pieces to help us to titrate that down. The PICO is just an instrument. You don't have to use it. But in this case, it might be useful to me. So the first thing I think about is, what is my population? You guys, anyone here around this table know what the population is?
Young teenage girls.
Young teenage girls. Gold star for Lizzie. So the I in the PICO stands for intervention. Are we considering a particular intervention? Dr. Tamrat, what do you think? What is our intervention here?
That using our...
Yes, exactly. So using macrodantin. Do we have a comparison intervention? Daniel?
Bactrim.
Bactrim. And what is our outcome of interest? Well, our outcome of interest is efficacy of treatment in this case. So what I did was I took all of this, usually it's much more, you have a lot more information and you're trying to titrate it down. I had a very simple case that I showed you. And so my P is for the PICO format. Again, this is just an instrument. You don't have to use it at all times. The P is for adolescent girls. The I is for macrodantin. We don't always have a C. We don't always have an intervention of comparison, which is Bactrim. And the outcome in this case is efficacy of treatment. The outcome can also be a negative. It could be mortality if we are looking at a question of mortality. So that's just something to think about. Now, I took this PICO and I then wrote out my research question. In adolescent girls, is macrodantin more effective than Bactrim in treating UTI? So the idea here is I took a lot of information. It wasn't a lot, but you know what I mean. You take a lot of information, you consider the pieces that you're interested in, and from that you develop the searchable research question. From here, I now have terminology that I can use. I can think about all the aspects of adolescence. I can think about macrodantin and Bactrim and the different ways I may search for UTI and drug treatment. And then I have the concept of UTI. So now I have pieces I can search for my search. The other thing we want to think about when developing the research question is we don't want to look really broad. Who wants to do this search? What are the health outcomes of patients with breast cancer? Any takers? It's too broad. This is more of something you would look in a textbook. This is not a research question. Then how about this? Is Bikram yoga more effective than Ashtanga yoga on perceived quality of life for women living with breast cancer? Well, frankly, maybe there's one article out there, if we're lucky, right? This is too narrow. So when we're developing our search question, we have to find that happy medium of what can we find? What are the effects of yoga on perceived quality of life for women living with breast cancer? That is a searchable question. There's the concept of yoga, quality of life, and breast cancer. That's a searchable question, and because yoga is an alternative therapy, there is literature on this. These days, you'll notice a lot of literature of alternative therapies when it comes to issues such as cancer. So that's why we came up with this question. So here's a question that I have, and I'm going to again pick on people around the table because the audio is off for my friends, but I want you to play the game as well at your own locations. Here's translating the question. In patients with postpartum depression, how does efficacy, that was my phone, how was the efficacy of CBT compared to SSRI therapy? So, what are some of the searchable concepts in this? What is one concept you could search for in this question?
Postpartum depression.
Correct, postpartum depression. And what are maybe two others that we could look at?
The two interventions.
Right. Cognitive behavioral therapy versus SSRI, which is the drug therapy. So what I've done here is I've in colors, in red, I have the concept of postpartum. That's one of my search terms. Once you develop the question, then you think about the search terms that you can develop from those. In the purple pinkish color, we have depression. In blue, we have cognitive behavioral therapy. And then we have SSRI therapy in red, or orange. That's orange. That's not red. Sorry. Again, I'm going through this very quickly, but this is the process that in my mind, for instance, I'm doing on my sickle cell search that I'm working on. Concepts and building the search. So my first concept was postpartum. Now, what are different ways for me to refer to this? I never know how to say that first word. I know how to spell it. I just can never say it correctly.
Puerperium.
Okay, we'll go with that. Puerperal, post-birth, postnatal, peripartum, and there may not, I may have missed some, but you get the idea. Depression. We're looking at depressive, sadness, anxiety, all those aspects that could define depression for us. CBT. I could use the short form and just use CBT for the search. That would be helpful. Cognitive behavior therapy, cognition therapy. There may be others I have not investigated. I need to investigate the terminology, maybe do some searches on just CBT to see how else it is referred to. Then we have SSRI. We know that means serotonin reuptake inhibitor. So let's keep on this step. And I'm quite sure that you've done this before. Searching the literature is very much like mathematics. If you recall from mathematics, when we conduct an equation, the brackets come first. And the plus and the minus, so the or the and would, the brackets always come first. Then comes the addition, the or the and here. What does or mean? Or if you do a search for postpartum or postnatal, you will get articles that are about postpartum and that are about postnatal. So if you think about your Venn diagrams from mathematics, so or is the union. That's when it's one or the other. So we have more literature, but it may not be connected in our question. So, and if you look on the right side, that is intersection, depression and CBT. So that's just the very middle piece here, the intersection of our Venn diagram. For some reason, I can't seem to find my mouse here. And that allows us to see, let me go back there. That allows us to have less information, less literature, but more on target. Sometimes we want to use or, sometimes we want to use and. What do I mean by this? So remember in the past search, we had our 4 concepts. Concept 1 was the concept of postpartum. What I've done vertically, and I often do this on a piece of paper when I'm writing down a search. So I'll get out a piece of paper and I'll say postpartum, and then as I do research, vertically I'll do all the ors. And then horizontally I'll add the ands, which means I want to combine concept 1, I want to combine concept 2, I want to combine concept 3 and concept 4. You, by the way, do not have to have 4 concepts. You may have 3. You may have more. The more concepts you have, the smaller the set of literature you'll have, just so you know. But you're combining those with or because you want postpartum or puerperium or puerperal but then you want to add that with and intersect that with concept 2. Now I'm going to show you something here. what I've done here is I've put brackets in there. The bracket in mathematics or in searching is done first. So what I've done here is I've done postpartum or puerperium. So everything that was vertical has been put into parentheses or brackets. And then I've combined it with the and, because I want to intersect that with depression or depressive. Again, but the depressive or depressive, one or the other. That has to be in parentheses. So that is searched separately. And again, the SSRI concept, search separately, then combined with the rest. And the CBT concept, search separately, one or any one of those three concepts, then put together with the rest. Does that make sense? If you please feel free to investigate that, think about that, or fill in the chat box as well.
Yeah.
And that's the idea of you may try this search out and say, okay, well, it's not working. I need to think about some other search strategies. But it's the idea of planning the search. Even planning the search like this makes you bring out more aspects in your own research. It's because you're being very thoughtful about the process. When you're organizing your search is step 3. So you figure out which terms to include and how to combine them. That's what we were doing. You also want to document your searches. It's really, really important that I make a record of what I just did. So when I revisit it, when I edit, when I add more terms, I have this. I cannot emphasize documentation more during the search process. We're not going to do this, but this is an exercise you might want to try on your own terms. So for instance, you may want to put in the search concept contraception there. What are alternative words for contraception? There's contraceptive agents. There's Mirena. There's, some of it might be on a larger scale, or some might be individual drugs. So you may be looking at IUDs. You may be looking at contraceptive agents, which is the broader term. So think about the different concepts. Or maybe you're looking at IUDs only. So what are other alternative ways for us to say that? That would be intrauterine and contraception. So different ways for us to combine those search terms. The fourth step, we're planning the extensive literature search. This is where I start to think about the databases. Well, that search on depression and CBT, I'm absolutely going to search in PubMed. I also would want to search the psychiatric literature. So I want to make sure I'm going into the psychiatric literature. We're also looking at each database that we search. We're looking at Google Scholar. We know how far back we want to go. So with this topic, do I want to go back 50 years? Do I want to go back 20 years? Do I want to go back 10 years? And it's important for us not to miss important studies. Some areas of study have been significantly investigated in the 80s or 90s. And we don't want to miss that literature. So we have to be cautious and thoughtful about when a lot of the work was done on certain areas of expertise, or even looking at retrospective searching. So if we're looking at retrospective searching and antiretroviral drugs amongst women with pregnancy, we may want to look at what the standard of care was in the earlier days and compare it to the present day. So that would be interesting. Geographic areas, again, material types. Now, PubMed gives us journal articles, but if we're looking for books and reports, we may go into the gray literature. Also, every database is looking at different articles. It's very possible that a journal you want to search is not indexed or not found in a database that you are looking in. So being aware, if there's a particular journal you want to find, or a particular source, that it is in the databases you are searching. And again, this is a review of the resources we're searching. Of course, books for reference, or book chapters, databases, Grade literature, and again, dissertations, clinical trials, white papers, are data sets. And then again, we always go to our experts. We always consult with experts, either subject experts or information seeking experts, such as librarians. Step 5, 6. Oh, look, we have 2 step 6s. Isn't that nice?
That is.
Yes. So I'm a global health informationist. I am not a math informationist, so I cannot tell a 6 from a 7. That's my excuse.
Math is hard.
Okay. So planning the search. We have running trial searches. This is really, really important. Once you have a search strategy, run some test searches. Is it working? As you're doing your search, are you finding new search terms you can add? That can be really helpful. Scanning your search results to evaluate relevancy. Is the articles you are finding on target? If not, review the results. How can you improve the search strategy? Another one, I always do this incorrectly, I have to always check. Have you combined your search terms correctly? And what I mean by this is, did you use an or when you should have used an and? Or did you use an and to combine when you should have used an or? So did you do union when you meant intersection, and did you do intersection when you meant union? It's very easy to make mistakes. And that sometimes I also have some of my colleagues, when I keep coming across problems, I'm like, I have been looking at this for a long time. Would you look at this for me and see if you can find if I've made any mistakes in my search programming here? And then they're like, oh, there it is. So no man is an island. You know who said that? John Donne. He's a poet.
I'm gonna say Simon and Garfunkel.
Simon and Garfunkel, no. Well, I would like to say no woman or man is an island, but John Donne was, he was way back in something like that.
17th century.
So always, do not think you're alone in any type of research project. Revise and rerun your search. Save your final search strategies and rerun them through the duration of your project. Another aspect is, I've often had colleagues who said, that search we did last year, we'd like to build on top of it. And guess what? I have it saved, which means that I can then say, here's a search strategy, let's work on it. So the idea of saving and documenting your search strategies is very important. Even more important if you're doing a systematic review or a scoping review, because the search strategy is part of the paper. There are advanced searching features, and I'm not going into a lot of those, but one of them is, for instance, searching with phrases. So in PubMed, if you searched heart attack, you could get the top article there, where attack and heart are in the title, but they may not necessarily, or the abstract, but they may not necessarily be in the same place. If you do quotations around it, you have a better chance of getting heart attack as a term. Revising, again, thinking about the limits. Are you looking for a certain type of publication? Do you only want systematic reviews? And most databases allow you to limit using this feature. A database like Google Scholar would not allow it. You may have to add that to the search. But PubMed, for example, is very strong in allowing you to limit to publication types. You can also limit to publication dates, language, so sex, subject. I would stay away from subject. I would allow the search to speak for you. Species, so for instance, if you're doing more of a basic research type of topic and you are looking at breast cancer in human women, you may want to remove mice, rabbits, because so much laboratory research also takes place. Ages can be very helpful, most especially limiting, using the database's own limiting features for pediatric and geriatric populations. Or women of childbearing age is another good one. Again, once you've done a search, maybe there's a better place for you to look. And this is a really interesting one. Perhaps you're looking for background information. more than a research question. Remember that first question we were looking at, what are the health outcomes of breast cancer? That's really a background question. So we think about, are you looking at a research question, or are you looking at a question that has already been answered in some of the reference materials already? So that's one that you have to think about when you're revising a search. And lastly, I seem to have gotten all my steps wrong, because here's step 7. But that'll select relevant articles, and this is important. It doesn't matter what you use, but we encourage you to use citation management software. Personally, I like to use Mendeley, but I also am, EndNote is fine, Zotero is fine, RefWorks. I like Mendeley for many reasons, and I will tell you that both Zotero and Mendeley are strong, they're rigorous, and they're free. Those are points for them. People do like to use EndNote, but it can be sometimes cost prohibitive because there can be a significant fee attached to it. That is up to you what you use, but it's important to organize your content. And you can organize it in whatever way that works for you, by publication type, by author, by study types. But it's important to be able to figure out and to train and get training on citation management. And one of the questions we always ask ourselves, because you can search forever, it's very possible to never stop searching. When are you done searching? Well, it depends on your publication type. If it's a systematic review, meta-analysis, it must be much more exhaustive and a much more systematic search. If you're looking at a specific research proposal, research project topic, it's when you feel that all the major sources that you should search have been searched. And when you are looking at, let's say, a new database, you're getting significant duplication of what you already have. And you don't really feel that there's any added value. So when you do feel that, okay, you feel that you've done a comprehensive search, that you've done your due diligence, you've searched several databases, you've used a strong search strategy, that is when you feel, and you are getting relevant results. That's important. Again, I cannot emphasize enough not only documenting the search strategy, but documenting the search process. You may need this for your search, your written paper. And also indicate the databases you used, indicate the search terms and the limits. So what year limits did you use? It's really important to think about the date of your search. So if you conducted your search in December 2019, and you publish a paper, and you include that, references from that search. If someone comes to you and says, you missed a major paper, it was published in March 2020, you can indicate that the search was conducted in December of 2019. So there is, yes, you are constantly searching for literature, but if you are including literature in a manuscript, there may be papers and relevant materials that are published after the fact of the manuscript date. But it's also just important for you to remember when you conducted a search. Because if you want to update that search, you can update you can do it only for dates, maybe for the last year if you want to do that. You don't have to do it all the way back. Searching is a cycle. So you are constantly reviewing your results, revising your search, rerunning your search, repeating it. We never stop gathering knowledge for a search or in our own lives. I know that I gather knowledge every day, and I know every single one of you are gatherers of knowledge every day, and the search is just a small piece of that. So much of this makes more sense once you are in and conducting the work of searching. So again, this is just an overview, and these are principles for you to consider as you search. So what I'm going to do is I'm going to very quickly go through this just because I want you to see the new version of PubMed. You'll also get these slides, so please do not feel that you won't get them. This is just a quick search. If you recall our search on postpartum women and postpartum women postpartum depression, and is SSRI more effective than CBT? This was, I ran that search. I posted it right into the search box, and I'm finding articles of relevance for me. So the second article there looked quite intriguing to me about a longitudinal study of depression symptoms.
We do have a question.
Yes.
Do the limiters have to be in capital letters?
Well, search limit the search limiters.
That was the word that is.
Okay. So what I was talking about was each database has options for limits. These could be years. These could be publications. So we're not talking about the actual word limiters. We're talking about limits or limiters as a feature of a database.
I'm wondering if maybe they mean the ors and the ands.
Yes. Oh, the combination. Oh, yes. Okay. They not necessarily. Some databases require it. Some do not. I have come into the habit of just doing that because in my mind, it just separates terms. For instance, in PubMed, I don't think it's required, but again, in my mind, I just do it because it's just a way for me to see my terms separated out. So it's not a bad strategy to do, but it's not necessary. Some databases do require it, and because of that, I do that just to make sure. It doesn't matter, frankly, in many databases, but it does in some. So you might as well just capitalize the ands and or. Thank you for that. I want you just to see the new version of PubMed. So the functions of PubMed have not changed, but the look has. If anyone has not gone to PubMed in the last week or so, this is brand new. There is a link to the old version if you still want to use the old version, and you can see that along the top of the screen here. But this just gives you an idea of what the database does look like now. It's a bit of a departure, and I've just put in a search, some search strategies in here. I'm not actually going to go through them today. I'm going to share the slides with you so you can use them for independent study. But just the fact that even this is the advanced search screen, and again, we can take you through this step by step, and looking at different ways of using PubMed. But again, it does have a significant different look, but the features themselves are all there. And I do encourage you to do PubMed searching. If you have questions, please connect with your library. I would also encourage maybe if you have journal clubs to take some time out and use PubMed and practice. And it's possible maybe in the future we can do another webinar on PubMed specifically.
We do have a couple more questions.
Yes.
All right, so there are cases where the only available information were documented many years back. For instance, there's no new literature about the anatomy of the cervix. Is it still bad to cite these references?
No, it's not bad to cite references. If you're doing new research and you're looking at the most important thing is, first of all, time is not a factor. If a time is not a factor in your search, you're not looking at in the last 2 years or something. Also, you just want to make sure that it is relevant and it is from a quality source of information, one you can trust. So if you are doing a search, it was cervix.
Yeah, the anatomy of the cervix.
If you're doing a research project in which you are citing, you do need literature that refers to the anatomy of the cervix. One option is to go to a reference book, because if you go to Williams Obstetrics or Williams Gynecology as textbooks, and I'm sure that you've seen those textbooks, the anatomy of the cervix is there. That's another place to look, because that is background information. That is existing information that none of us is disputing. That the anatomy of the cervix is the anatomy of the cervix. So if you're looking at an article that provides some aspect of that, you just want to be sure about the quality of it.
Okay. and then we've got a few more.
Mm-hmm.
Is the search strategy for systematic and scope reviews different?
It's not different. It is more, you have to be more comprehensive. You have to be more thoughtful about saving the search strategy, and the search strategy and implementation of it is the methods of the paper. So that creates a whole nother level of significance for the search. So I don't specifically want to focus too much on that because that is a very lengthy training process. But I will say that for a systematic review search, you need to be more exhaustive than if you were just doing a research proposal. A research proposal project, you want to be absolutely comprehensive, no doubt. But with a systematic review search, you have to work towards saying that we did the most exhaustive search that we possibly could. And then you go through the process of critical appraisal. So there's a different level of searching there as well.
What are refereed and non-refereed publications?
Scholarly versus non-scholarly. So it's just another way of saying refereed means it has gone through peer review, or for instance, non-refereed can be reports, but at the same time there's value in reports from organizations. A dissertation is refereed, but it's not a journal article. So looking at scholarly literature, we can have different kinds that are refereed versus non-refereed.
What is a white paper?
A white paper. How do I define a white paper? So a white paper is usually a position paper that is published by an organization. I'm actually presently looking up a definition of a white paper because I don't want it to be inappropriately placed. But white papers can be position papers. They can be a definition of a certain concept or topic. And the way that it has been, it's indicated in this is from Purdue University. Typically, the purpose of a white paper is to advocate that a certain position is the best way to go, or that a certain solution is best for a particular problem. So, for instance, CIRHT may publish a white paper because CIRHT may, just as an example, may think that their framework for post-abortion care is an excellent way to go forward in that area of research and implementation.
What is the duration in years to say recent evidence for the searched articles?
That I don't have an. I would not even say recent evidence. I would say what the years were. That the search was conducted for literature in a 10-year scope period, indicating that was done from 2009 to 2019. So recent evidence is a very nebulous. It can mean so many different things to different people in different areas of specialty. So you could say we searched the recent evidence, and that for us means the last 10 years, the last 15 years. Because in different areas of expertise, the last 15 years is actually recent. When we're talking about contraception, that's not the case, because there have been so many more, so the technology has changed, innovation has changed. So if you're going to say recent, I would encourage you to say what you mean by that. There's no real absolute definition in scholarship for the recent evidence, to my knowledge.
Okay, this person would like to know if unpublished literature and expert opinions could not be uncertainty and be a good source of bias.
Unpublished literature can have a bias to it, but it also is the purpose and the way you are using expert opinion or unpublished data. First of all, you're indicating it's unpublished. Secondly, expert opinion is a level, we saw the pyramid, the level of evidence pyramid. Expert opinion is on the bottom of that pyramid because it has not been refereed, it has not been peer reviewed. That does not mean that it does not have some aspect of use in a study, as long as it's cited as unpublished or cited as expert opinion.
How should we organize the search document?
That is up to you. I'll tell you that the search, and I don't know what if they mean by search documents, saving the search strategies. I save my search strategies, I download them and I save them in a Google Doc. But I also save them within the database that I'm working in. So I have a backup.
What about the actual articles? What about when you get your 15 or 20 articles? How do you save that?
I save those in citation management. So I will save my articles in whichever citation management tool that I'm using. As I said, I prefer Mendeley, but I am not discouraging you from using any other citation management tool that you feel is relevant and useful to you. I feel Mendeley, Zotero are very good ones because they are ones that are used in the area of scholarly communication, and they are freely available. Their EndNote also is a very good one to use. The only reason that I'm suggesting that is a personal opinion is because that there is a cost attached to using EndNote.
Where can we find unpublished resources?
Well, that's a question. That's a really good question. Unpublished, some papers will have citations for unpublished. Also, you may communicate, and through expert opinion, when you're communicating with mentors or you're communicating with others, you may see unpublished information. It's not like someone who's about to publish a paper is going to give you their manuscript. We all know that that is not the case, because they want to publish their paper. But it's a matter of if it comes across to you through an expert opinion, or someone says, I've done some work on this, I would be willing to share with you. So searching unpublished data can also mean looking in clinical trials registers to see what has not yet been published, but it is what we call gray literature. It is in the process because it is an ongoing clinical trial. There are many different ways for us to look at that, at what we consider to be unpublished. You also may have an unpublished data set. It may be your own data set, but it may be unpublished. So it's very difficult for me to answer this question, but it's one of those things that when you see it, you know it.
How do we use mesh terms in our search strategy?
Yes, that's a very good question. And you probably noticed that I stayed away from that in this particular webinar. Mesh terms, when I search, I use a combination of medical subject heading, which is controlled vocabulary in PubMed, in combination with keyword searching. I use a combination of both. Now, other databases have their own controlled vocabulary. So other databases may require you to use something other than mesh, because mesh is only specific to PubMed Medline. Another issue is that some databases don't have controlled vocabulary or subject heading searching, such as Scopus or Google Scholar, so it really depends. I will create a search in PubMed as one of my root searches. So like this is the search I'm going to base all of my searches and all of the other databases on. And I do include medical subject headings that are appropriate. I do look at articles that are relevant to me and see what medical subject headings have been attached to that article in the paper. And the reason why I did not go through that is because we only had 1 hour. But yes, that medical subject heading searching is another advanced feature that that we can investigate further.
All right. We've got, let's see, what about level of evidence?
What about level of evidence?
That is the question.
Okay, if that is the question, we will take a look at level of evidence. If you're talking about level of evidence for different types of publication, so if you were doing a systematic review on treatment, you would want to be, for the most part, you're looking for systematic reviews of randomized control trials. For instance, Cochrane database is a database of systematic reviews, but specifically on treatment. So you will see randomized control trials there. So it depends on what your needs are. If your clinical question is dealing with the concept of prognosis, you may want to go to cohort studies. If you're looking at risk or etiology, you may want to go to case control. The issue here is, yes, we do see systematic reviews and randomized control trials as the higher levels of evidence. But if you're not necessarily looking at a question that can be answered by a randomized clinical trial, and you're looking at risk or prognosis, you may be looking at lower levels of evidence. But in the case of your question, that is the highest level of evidence that you can, that is most appropriate for you. So that's something to think about, is the type of question you have will identify the type of literature types that you will look at. So for instance, you have questions of diagnosis, questions of etiology, questions of prognosis, and questions of therapy. These types of questions apply in the clinical setting, but I would infer that they also apply in the research setting.
All right, we've just got another one. What's the major difference between recent and previous PubMed interface, just rather than merely on its new appearances?
It's a new appearance, and some of the features are in different places. So, for instance, the search details, which we found on the main page, are now in the advanced feature. And I'm still finding new things. Literally, I'm telling you, this is 1 week old, and I am still in the process of learning where some of the new pieces are. There will be webinars from the National Library of Medicine and YouTube videos from them that will be posted on their site. If you go into the new PubMed's help section, you'll also see more information on where things are settled. I am literally in the process of just going through that. Overarchingly, the features have not changed, but some new features have been added. So that is something that we're in the process of investigating, learning, and you may see things in different places. One thing that many of us rely on is the related articles information or similar articles information. That is now in a different location. I believe if you click on the abstract of an article, you'll see the related articles there. So it's just a matter of the most useful thing to do with the new PubMed is to conduct a search in it, just for practice. And as I said, that's why it would be a good practice or a good exercise for you to study it together, for instance, at a journal club or a research meeting, just so you all know what the new PubMed looks like. You can always use the old PubMed, but I am not certain, but I am certain it will go away. I'm just not certain when the old PubMed will go away. So it's best to get familiar with the new look of it. Also, I cannot emphasize as much the wonderful resources of the librarians you have on site. Thanksgiving is not necessarily a holiday in Rwanda or Ethiopia, but it is for us. And many of us are going to we call it to give thanks. And I found this quote and I wanted to share it with you. It has nothing to do with searching. Or maybe it has something to do with more of human searching, not scholarly searching. It is not joy that makes us grateful, it is gratitude that makes us joyful. So happy Thanksgiving, and thank you so much. And I look forward to joining you at our next webinar when we'll be talking about data sources.